So I think imaging has made an enormous difference into how we manage patients. So if we look back 50 years ago, in order to assess the spread of someone's cancer, you might be able to feel it, but on the whole you need to give them a big cut in the abdomen to assess the cancer and see whether they're operable or not, and have to make quite quick decisions. Then we moved on to have CT scans, which allowed us to have cross-sectional imaging, so we could assess the size of tumours. But what's happened beyond that is we've got different imaging modalities, including MRI scans, PET scans, and over and above that, those scans now, we're able to use artificial intelligence or similar technologies to interpret much more than we'd see in the naked eye.
If we consider the top 4 cancers in the UK, which are colon, rectal, lung and ovarian, if patients presented at stage 1 for treatment as opposed to stage 4, this would benefit 11,000 patients' lives per year in their treatment, and also offer cost savings in excess of 44 million. The first thing we need to do is diagnose a cancer. We need to classify it. We need to know exactly what's in that cancer, what type of cancer it is. Then we need to look at the staging. We need to see how bad it is, how it's acting within the body. Now, spectral imaging is still its way of leading into that space. Now we can use a spectral scanner to be able to acquire all of that information in one place, so we can literally diagnose the presence of it, classify it and stage it within one scan. So rather than having to have multiple interventions and multiple scans, they can have one and spend more time at home with their friends, family, loved ones.
There's a new evolving field in imaging and advanced imaging called radiomics, which is basically trying to extract more objective data from diagnostic imaging, and then pulling that data, generating that data, and pulling it with other clinical features to gather more information about the cancer phenotype, and that in turn allows us to better stratify the patients. So for example, patients who to naked eye with the tumours look the same, actually by using radiomics we can stratify these patients or these tumours better, and that will allow us tailored or individualised patient treatment.
In terms of the technology, we do have the ability to treat more patients within a certain time scale, and we can sometimes use less fractions of radiotherapy and condense the treatment into a much smaller period of time. So these are all advances that will help with patient workflows.
I strongly believe that advanced imaging is a cornerstone of radiotherapy treatment. Incorporating better, more modern imaging will enable us to tailor the radiotherapy better, will also enable us to deliver the radiotherapy more accurately, and that in turn will result in better outcomes, improved treatment efficacy, and ultimately improved patient experience.
By having a digitised image, the pathologist can look to share that with their peers, gather more insight and information from it, and also we can look to apply AI on that digitised image so we can predict patterns of behaviour. So if we're going to apply a treatment, then we can see how that specific sample would react to it, so we can set them off in the best possible outcome.